Introducing the LapEz VN, the specialized training solution designed for mastering vNOTES surgical procedures, building upon the success of its predecessor, the LapEz Laparoscopic Trainer. LapEz has special features like inbuilt insufflation, inflatable lid, vNOTES port, artificial perineum and vagina. Hysterectomy training on LapEz vNOTES. vNOTES hysterectomy is a minimally invasive surgical technique used to remove the uterus through the vaginal canal without making any external incisions on the abdomen. Shown in the video, LapEz has realistic anatomy. You can identify the features like bowel, liver, gallbladder. And here there is an entire model of uterus, ovaries, fallopian tubes that mimics the near-live anatomy. After the initial steps, a speculum is placed posteriorly and another speculum is placed anteriorly in the artificial vagina. The cervix of the uterine model is held with the LapEz forceps. A wound retractor with a thread tag positioned posteriorly is railroad down the LapEz forceps. At the first, placing the inner ring anteriorly in the interior pouch. Subsequently, sliding the inner ring posteriorly over the speculum, in such a way that it passes beyond the edge of the vagina. Make sure that there are no twists and turns on the wound retractor. The outer ring is then folded until it snugly fits and retracts the vagina. Subsequently, vNOTES port is applied in such a way that 12 mm valve at 6 o'clock position. Consequently, the insufflation tube is connected and the air insufflation is begun at 12 mm of mercury. The artificial abdomen or the lid can be seen to be inflating. As well, the vNOTES port become inflated with the air pressure. A telescope is then introduced with the help of an assistance, and the cervix of the uterine model is visualized. A grasper is introduced and held by the left hand of the surgeon, while the scissor is introduced by the right hand of the surgeon. Instead of a vessel-in device that is used in a real surgery, a scissor can be used to cut the pedicles. Various structural features of pelvic anatomy can be seen, including rectum, ureter and sacral premonitory. The hysterectomy steps are continued with the sequential division of the ovarian ligament, round ligament and the fallopian tube of the uterine model. The model mimics various dynamics of vaginal hysterectomy procedure. Subsequently, same steps of the hysterectomy are performed on the right side. In this hands-on training model, the surgical hand movements and the behavior of the anatomy in response appear to a real vNOTES hysterectomy. Consequently, the vNOTES hysterectomy is completed with sequential division of all the pedicles. The vNOTES port then can be removed, and the uterine specimen can be extracted transvaginally. LapEz VN sets a new standard in vNOTES surgical training. From intricate instrument manipulation to precise tissue dissection, every aspect of the vNOTES procedure is meticulously replicated for a true-to-life learning experience.